So let's talk a little bit about the role that the media plays. We've seen the role of the media really expand in the last few years, and it can be kind of a double edged sword. It's great for sharing information, but sometimes it can be used to spread misinformation. How has that affected your work, either hindering or helping?
Yes, I do agree with that, and I think media is with my experience, I've learned that if anything, it's important with the implementation. It's also having the right balance with the communication, with advocacy, with having the IC materials, and media is an important aspect and needs to be embedded right from the inception phase of the planning, right? So I think I do agree with that. And I initially, in the start of my career, I felt that we were not doing a good job on the communication and advocacy to get the coverage we wanted. But I've seen that that's the emphasis put more on the communication side over the years. So I feel I'm happy to see that. But I've had several experiences working with the media, and I think it's been very, like I said, it needs to be embedded with the plan and for running a good campaign or a SIA or even for new vaccines introductions. I think you should really synchronize the work with the communications and media to get a good coverage. And one of the sensitive area in my experience, I've kind of realized is to kind of on the vaccine safety area, right? So that's more of an adverse effect following immunization. And one of the very experiences while working with a few countries I've seen is that there have been some unfortunate incidents with after administering a vaccine, right? And this really it really had a very negative impact on the immunization program immediately because the media tends to kind of just publish it and not knowing the full picture and not understanding that a process of there's a process of a causal relationship to kind of needs to be determined for concluding at least if the adverse event is vaccine related or it's a coincidental or or what the cause could be. In my experience with a certain incident, I felt that didn't happen, and but eventually we were able to work with the Ministry of Health and with the media and just kind of work it out and establish a causal relationship and really determine that it was not due to the vaccines. And also with the media, I feel that as a very technical person. There is a lot of science and evidence that we are gathering to kind of put the information out there, but it's also important that we have one spokesperson from the Ministry of Health or from WHO to kind of give the consistency of messaging right throughout the event and identify focal points as a spokesperson. And I think it's very important to keep the media in loop to get the right message out there. So that was one of my experiences working with the media.